Dr. Morgan, always good to see you. First off, what was your reaction to this? I mean, how exciting is it to know that, this weight loss drug could also have other health benefits?
This is certainly exciting, and we saw earlier publications as well starting to move in this direction, especially in the heart failure space. And so while this is exciting, it's not surprising because we've seen the wave of how this is moving forward. And when it was finally revealed on Saturday at the American Heart Association Scientific Sessions in Philadelphia, it was with wild enthusiasm.
So then what does that mean for the future of the way that this drug will be prescribed?
And that is the million-dollar question, Amra, because certainly there are questions remaining for physicians. For instance, when do I start this medication? How long do I keep a patient on it? When do I stop this medication? Can people afford it? Will this be a lifetime medication? And so all of those things need to be addressed. Additionally, with regard to who's going to benefit, this particular trial, this SELECT trial, that's the name of the trial by Novo Nordisk, enrolled over 17,000 participants, all of whom were obese, but did not have diabetes. So we specifically looked at obese patients who had a diagnosis of heart disease, and then looked at something called MACE, major adverse cardiovascular endpoints, which means we looked at heart attacks, we looked at stroke, and we looked at cardiovascular death.
And I understand that, of course, there are risks associated, especially for those who have some gastrointestinal issues. So they should obviously talk to their doctor if they want to get on this drug. But in terms of Wegovy and these other weight loss drugs that are coming in the market, are they sustainable to use for the long term?
That is the question. These are questions that need to be answered as we unfold, including the cost. Cost is over $1,000, $1,300 per month. When we look at this particular trial, the highest dose was used of this semaglutide, this Wegovy, 2.4 milligram injection once per week. But in practice, doctors actually titrate up to this dose. So do we start at this bigger dose, this most maximum dose, or do we titrate up to get these cardiovascular effects? In this trial, the 2.4 milligram dose was the only dose that was used. One of the concerns when I looked at this trial that I have is with regard to the patient population. We see that 84% of the enrollees in this trial were white and 72% were men.